Welcome back to Lymphoma and Related Diseases Registry, LaRDR. Today I'm very happy to have Dr. Kyle Crassini next to me. Hi, Kyle.
Hi, how are you?
I'm good. Can you tell us a bit about yourself?
I'm a clinical haematologist at Coffs Harbour Health Campus. I've been there not that long, about 8 months or so. I previously trained in Sydney, North Shore Hospital and Royal Prince Alfred Hospital, and did my PhD at North Shore Hospital before a transfer fellowship at Royal Prince Alfred Hospital. That's me. I've been involved for a little while through trials, so I was an associate investigator on the ICANN trial and the rationalised trial, so I'm aware of the work that LaRDR's done, and I'm now the PI of the LaRDR Registry at the Coffs Harbour site.
You mentioned you had a PhD. Can you tell us about that?
So my PhD was CLL focused. A large part of it was science-based, but there was also a clinical aspect to it in that I undertook a trial looking at IVIG versus SCIG in CLL patients with a view to trying to establish some trial evidence for the use of immunoglobulin replacement and SCIG.
I see. So your expertise in CLL and IVIG would be very useful to the registry. So as a site PI, do you know what you will have to do?
Well, I have to interface with LaRDR centrally and go through the process of ethics and site approval and getting the site up and running. I guess once up and running, the role will be to spread the word about LaRDR locally, consenting and putting on my patients, but also speaking to the other clinicians there about LaRDR and trying to encourage more broader site involvement.
Do you have to manage the clinical nurses or data entry people?
Yeah, absolutely. So we've got quite an active clinical trials unit there, interfering with the trials nurses and the Heme CNC in terms of ensuring that patients are aware of what we're doing and data is entered.
Coffs Harbour Health Campus is a regional site. Why do you think it's important for the regional sites to come on board?
My belief is typically regional sites tend to be underrepresented. So I think for a small centre in the region, it's a way of being involved in a national dialogue with other lymphoma researchers. The benchmarking aspects of the registry are also important. As a single centre, admittedly with a few haematologists, but the opportunity to see how our patients are going compared nationally to their peers, I think is very important. It sort of keeps you up to date in a way with what else is going on in the nation and how our patients are doing. The regional aspect helps capture the diversity of the population. Coffs, for instance, has a very large Sikh community. Involving those people, rural and regional people, in the broader database, I think is important.
Are you aware that you are able to submit study proposals to us for steering committee to approve? Would you be interested in?
Yeah, I mean, I think in the future, definitely, rationalising ICANN, it's an incredibly powerful tool to answer questions. In the future, if there are things that I'm interested in exploring, or even locally we're interested in exploring, we can leverage the database to help answer those questions.
Awesome. So currently we're doing governance approval with your site, so hopefully they can get approved and we can start entering data.
Yeah, absolutely. We're looking forward to getting on board.
Yeah, definitely. Yeah. Thank you so much for your time today.
Thank you.
Thank you. See you next time. Bye-bye.